Hi guys, Erin here. In this video, we'll be talking about the different types of factorial designs, and we'll be just re-emphasizing why do we want to do this anyway. We'll talk about some key advantages of doing factorial designs over designs where we only have one independent variable. So let's talk about the different kinds. There are lots of different kinds. There's a lot of flexibility in what we can do when we do factorial research. We can have two between subjects factors, we can have two within subjects factors, we can have a mixed design where we combine a between subjects and a within subjects factor. And these factors can be manipulated by the researcher, so they can be experimental factors or not. They can be non-experiment or quasi-experimental factors. So let's say, here's an example of a two between subjects factor question that is very relevant for you. You may remember back when we did the describe our class activity and I had you fill out those surveys and I had you answer questions like whether you live with your family or with your roommates and whether you have an online textbook or whether you're using the hardcover textbook. I also have your midterm scores. So let's say we wanted to know whether those factors either on their own or together impact students' exam scores. So we want to know, do students who live with families score higher on a midterm than students who live with roommates? Do students that use hardcover textbooks score higher on a midterm than students that use the online textbook? And is there an interaction between these variables? Does living situation have a different effect for students that use different kinds of textbooks? Similarly, does the textbook format have a different effect depending on who you're living with? So all of these are between subjects factors. In this case, they're non-experimental because I didn't manipulate it to make you have these different levels. We're looking at different groups of people that exist in our class and to see whether there's a difference between these four different groups in how well they did on the midterm. So what do you think? What do you predict from this? Well, let's see. The answer is you guys are all superstars. The average from this year's midterm was higher than it was last year and the year before, so you should be really proud of all the work that you've been doing. The conclusions from this study would be that there would be no main effect of living situation. Students perform the same on the midterm, regardless of whether you live with your family or with your roommates. And there's no main effect of what kind of textbook you have, whether it's online or hardcover, and there's no interaction. Having one level of one of the factors doesn't impact the difference between the other levels. I gotta find a way to say that easier. No main effects, no interactions. You can see that everybody is scoring right about the same. And this is also, I did enter this into an ANOVA to find that there's no significant difference between groups. So even though the average might be a little bit higher in this group, it's not statistically different than any of the other groups. Here's an example of a mixed design. So last week we talked about pre-test, post-test control group designs. This is a great design to use for your research proposal if you're interested in a particular treatment and you want to see whether people differ before or after treatment and you want to compare your treatment group to a control group. If we compare pre-existing groups that are already getting their treatment and we can't assign them to the different treatments, then this would be an example of a mixed design. We've got a between subjects factor, our different treatment groups, and we've got a within subjects factor before or after treatment. And all of them are non-experimental design because we're not manipulating group or time. So this is an example of a mixed design. We can also have a combined design where one factor is manipulated by the researcher and the other is a pre-existing factor, and we can combine them in the same design. So a pre-test, post-test control group design can also be an example of a combined design if we were able to manipulate that independent factor of treatment group. So if we were able to randomly assign participants to either receiving your treatment or a control condition, now we've got an experimental factor and we're combining that in the same design where we're looking at how people's, self-esteem changes before and after these different treatments. So pre-test, post-test control group design where we are randomly assigning people to different groups is an example of a combined design. In my research, I do combined design sometimes. Here's an example of when I do that. So in this study that I published this year, I can give you a link if you're interested. We wanted to see how do children's brain responses differ when they're listening to speech that makes sense versus speech that doesn't. And we wanted to see whether these brain responses differ depending on how old the children are, so whether they differ with development. Our participants are different groups of kids. I can't randomly assign them to be young or to be old, so this is a between subjects non-experimental factor. It's also an example of a cross-sectional design because I'm looking at development by comparing different groups of kids, young kids, older kids, and adults. I had them all come into the lab where these EEG caps where I can record the electrical activity from their brain when they listen to different stimuli types. And this is an example of within subjects factor because I counterbalanced multiple different kinds of stimuli in the same design. And I controlled it and I manipulated what they heard. So they watched videos, Pingu videos, and the narrator either used sentences that were, that made sense, that were correct, like Pingu is eating toast for breakfast, and there was a video of Pingu eating toast, or that didn't make sense, like Pingu is eating pants for breakfast. And I wanted to see whether there was a difference in the brain response when people listened to sentences that didn't make sense versus sentences that did make sense, and if this difference differed depending on how old the kids are. So this is an example of a combined factorial design. As an aside, again, if any of this interests you and you're interested in looking for some research experience, feel free to send me an email. We're always looking for people to join our lab. So here's a question for you to think about. Imagine you were interested in the effect of different kinds of cognitive behavioral therapy to treat claustrophobia. You randomly assign people to either or people who have claustrophobia, and you randomly assign them to two different treatment types. One was flooding, where they have to experience the anxiety, they have to stay in a small room and they have to just experience it until it passes. Be very stressful, but it has been shown to work, flooding. Or maybe we wanted to see the effect of a different kind of treatment, modeling, where instead of the people themselves experiencing that claustrophobia, they watched other people experience it and overcome it. So we wanted to look to see whether there is a difference in people's feeling of claustrophobia depending on what kind of treatment they received. And so we measure people's feelings of claustrophobia before and after treatment in our two different groups, but we didn't just want to see the effect before and after treatment, we wanted to follow them up, and so we tested them after 1, 2, and 5 years after therapy to see if the improvement persists over time. So why don't you pause the video and see if you can answer these questions. What are the factors? How many levels does each factor have? And what kind of design is this? So pause the video and see if you can answer it. Okay, hopefully you're back. The factors here, we've got two independent factors. Those two factors are type of treatment, and the other factor is time. How many levels. Our treatment is easy. We've got 2 levels of that treatment. The time factor is much more complicated. We have before, after 1 year, 2 years, and then 5 years. So we've got 5 time points. So this kind of design is a 2 by 5 design. And because we're randomly assigning people, we've got a experimental component, and we're looking at time, which we can't control, so that's a non-experimental component. So this would be an example of a combined design. It's also a great example of why you want to keep it simple. If we're comparing 2 groups of people at 5 different time points, that's a lot of data. For your research proposal, make your life easier. If you're going to do a factorial design, only have 2 levels of each independent variable. What kind of stats do we use when we do factorial research? Well, typically what we use is what's called an ANOVA. And if we've got 2 factors, we do what's called a 2-way ANOVA. And an ANOVA, basically in one click of your button on using a statistical program, you can say whether there's a main effect of each of your variables and whether there's an interaction between them. The details vary, and the kind of ANOVA that you do differs depending on whether you've got between subjects or within subjects variables, so whether the same participants are, serving as their own control. That gets a little bit more complicated, and you'll learn about that more in Chys 3P15. For the purposes of our course, just know if you are comparing two different variables, like a pre, post, control group design, you're going to want to do a two-way ANOVA. So why do we want to do this? Let's go over the advantages one more time. First of all, it creates a more realistic situation than examining only one factor in isolation. Factors don't exist in isolation. They're interacting all the time. With this kind of design, we're able to measure how each of the variables on their own impact the dependent variable, if one variable has more of an effect than the other variable, and we can look to see how the combined effect of them together impacts our dependent variable. Another advantage is that mixed designs and combined strategies can make up for some of the shortcomings that we talked about in the previous weeks that can happen when we just look at one design on their own. And so as a result, factorial designs can increase the internal validity of our study. So as a review, we've talked about this in previous weeks. What are some of the pros and cons of a between subjects design, pros and cons of within subjects design? See if you can answer that as a good review for yourself. Mixed designs can make up for some of the downsides of each of them, and I'm going to show you that right now. So the major downside of a between subjects design is that we've got those individual differences, and that they can be a confound if we don't control for them and make sure our groups are equal on those extraneous variables that we don't care about. Factorial design is great because rather than controlling for them by limiting them or restricting the age or just looking at one level of them, we can actually include them as a variable in our study. So if we wanted to look to see how, let's go back to that overused example, I'm sorry, I've been using it so much, about kids, whether they're more aggressive when they play violent video games versus non-violent video games, rather than only testing girls, now we can include gender as a variable in our study. Similarly, if we wanted to see whether having two parents at home or one parent at home had an impact, we can include that as a variable in our study. Whether kids have ADHD traits, we can include that as a variable. Rather than having to control for them or limit who is a participant in our study, we can include them as an extra variable in our study. So this increases the internal validity without sacrificing the external validity. Similarly, one of the major downfalls of a within subjects design is that the order of a treatment can be a confound. If people get tired or bored in our study and tend to do worse at the second half of the study, this is an order effect. And we talked about how counterbalancing is a solution. So half of our participants get, the second condition first before they get bored, and they get the other condition second so that they get bored, and you make sure that participant 1 gets this order and participant 2 gets this order. We balance it across all of our participants. And we talked about how that avoids the problems to internal validity, but it doesn't get rid of the effect of the order effects. Well, we can include order as a variable in our study, and we can actually explore whether it's a problem or not, and the extent to which it's a problem, and whether it's affecting one condition more than the other. So we can just say first half of the study versus second half of the study. That would be a new variable in our experiment or our design. Finally, the major overarching goal of factorial designs is that they allow us to replicate what's been done before, and we can also extend it. By including another variable, we are able to see whether effects that have been shown in previous studies can, first of all, whether we can measure those ourselves, and then as a second step, also see whether they generalize to other groups of people or other conditions or other environmental factors. So factorial designs really allow us to increase the external validity of our study. So to summarize everything we've talked about in these videos, factorial designs involve more than one independent variable. They allow us to examine more complex situations, more true to life situations. In factorial designs, we examine the separate effect of each factor on their own and see whether they impact the dependent variable, and to see whether the impact of each is the same on the dependent variable. As well, we can see how they combine with one another to jointly affect the dependent variable, whether one effect of one depends on a level of another. Factorial designs allow us to combine different research designs and different research strategies together. The main overall goal is that it allows us to replicate and extend previous work. That's all for this video. Thanks so much for listening, and we'll see you at our next meeting. Take care. Have a good day.